25th meeting of the HPRS. I do appreciate everyone joining, even though we changed the schedule a little bit. We had some time sensitive material that we needed to go through. So I apologize if the date caught people off guard, but it's very important for us. Really, our primary role, one of our primary roles in this advisory council is our CoC work. And so that's going to be a lot of the work today. So I want to welcome everyone to the meeting. I'm Allison Kerr. I'm the chair of, newly elected chair of the HPRS. And I'm pleased to announce that Susie has agreed to be the vice chair. So we will be leading, but very much listening and being a part of all of you in this HPRS group. So land acknowledgement. So I always it's one of those things when you talk about the land acknowledgement, we know that it's a formal statement, but really it is recognizing the indigenous people of Alaska. And it is a public gesture of appreciation for the past and present indigenous stewardship of the land that we now occupy. So the Anchorage Coalition to End Homelessness and the HPRS Advisory Council would like to acknowledge that we gather today on the traditional lands of the Dena'ina Athabascans. For thousands of years, the Dena'ina have been and continue to be stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovations, and contemporary perspectives of the Upper Cook Inlet Dena'ina. Now, I will say that in Zoom land, sometimes we're not all on the Dena'ina land. I am actually in Florida on Seminole land. So I appreciate the beautiful sun and beaches that are offered to me, and am respectful and acknowledge the Seminole. So let's go ahead and a mission moment. Okay, help me watch for hands. I know you guys are going to be throwing those hands up quick. Dave, it's funny, you're sideways. Oh, there you go.
Well, you know, I'm always good for a mission moment if no one else hops in.
Yeah, you go for it, Jess.
I'm going to share two mission moments. One I was reminded of when you commented about Dave joining. So we had the joy of hosting the current batch of interested parties who want to volunteer to help with the Family Emergency Cold Weather Shelter. And I was overjoyed to be presenting and sharing information with over 40 individuals who showed up on a Sunday evening to hear more about this opportunity to volunteer and share and participate in the Family Emergency Cold Weather Shelter. So that is my mission moment number one. My second mission moment is 5 ACH staff members just spent the last week down in Washington, D.C. attending a Community Solutions Built for Zero conference. Built for Zero is the nationwide initiative that works towards achieving functional zero and solving homelessness for the United States, along with a few partner countries. Canada has joined Built for Zero. So it was just wonderful to be able to connect with other providers who are working towards functional zero in their communities, other representatives of COCs that have some of the same challenges we do, and then also representatives of some COCs who have achieved functional zero for either subpopulations or in one case their whole community. So it just was really wonderful to make those connections, have those conversations, and sometimes commiserate with them as well with some of the same challenges. But it was great to make those connections and talk with different organizations.
Josh, I would just add, Covenant House was one of the groups that was in the first, Built for Zero. And last year was the first year in our history that we had more people in housing than in shelter. And so it does work. And it is definitely, I appreciate the coalition continuing and, shepherding that work for Built for Zero. It's great. It's a great group, and they've done some great things around the US. So make us all better. Okay, so next we're going to go into the consent agenda. And I do know that one of the things that, as the executive of the advisory council and the board, we really wanted to work more towards some transparency of this meeting. And so therefore, in the past, we have done some of these work items prior to joining the public meeting. Going forward, we're going to do this work in the public meeting. And so for those that might be new joining us in the public, then the meeting agenda, minutes that need to be approved, all these items that you would need to be able to participate in the next council meeting are on the coalition's website. And I see that Jess has just provided a link. So make sure you copy that link, and then that way you too will know what is going to be on the agenda. And if you have items that you want to place on the agenda, then we can work through that as well. So that being said, we have an agenda before us. Do I get a motion? Do I have any changes to the agenda?
I'll move to approve the consent agenda.
This is Susie. I'll second.
All those in favor? Aye.
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 So with that, in the past, we have been combining the approval of the minutes with that approval of the consent agenda. So I don't know. I think we'll go forward with that practice. So next time as we go through this, if you have any items or corrections for the minutes or would like to add anything, then please just make sure that you bring that up before we approve the consent agenda. Okay, so let's talk about our community council, our committees, and seeing if any of my committee chairs can give an update.
Allison, I'm so sorry to interject. This is Emily. The top item on the PowerPoint is my bad. I forgot to change this. So the emails listed on website, you can completely disregard.
Yeah, we will have a list of all of the council members, and then there is going to be a email link to, if it's info@HPRS. I don't know it either, Jess.
Advisorycouncil.org.
There you go. There you go. So if anybody wants to reach any of the council members, please feel free to email that address, and they will make sure that the appropriate party gets the information. There you go. Okay, now let's get into some committee work. Who is my first brave chair?
Well, this is Sid, if no one else has stepped up. The Compliance Committee was responsible for participating in the scoring of the applications from the organizations. We'll be talking about that at later, but two quick messages to everyone. Number one, HUD prefers to have their money used for new initiatives. Our historical funding at ACEH and now HPRS Advisory Council has been to continue existing programs ad infinitum. But this year we had 10 excellent applications for new initiatives. And as Jessica will point out later, we were able to work 2 of them into the mix. But I want to encourage everyone to use the HUD money as seed money to build their organization while they find other sources of money so that we can reapply the HUD money to new initiatives. That concludes the report of the Compliance Committee. Thank you.
Thanks, Sid.
I can report on the data committee.
Okay, Sharon?
Okay, so the data committee met last week. We meet every third Wednesday of the month from at 3 o'clock. And we had 2 items that we discussed last week. The first was the issue of how should income be measured in terms of HMIS data. And we had clarification from HUD that the PFD and dividends should be included in that. And so we discussed how we should go ahead with sort of getting all of the providers who input into HMIS to be doing that in consistent fashion. And did we need to go through the HMIS statewide to sort of get them to sign off on that? But it turns out that method of measuring income is as it always has been. And that is part of the training documents that currently exist. So we decided that probably the best way is just to communicate with providers, just sort of a reminder that, you should be measuring income this way. And so we talked about different strategies for getting the word out for that. And then the second thing we talked about was whether there is a need for the mobile intervention team and the mobile crisis team that are operated by the police and fire departments for them to be able to access HMIS. And I think generally our conclusion was that we couldn't really see a need for them to do that. And in fact, the item just got on the agenda because I heard a community member, who is a provider, saying that it would be good if they could have access to that. But we have not actually heard any request from police or fire for them to have access to HMIS. So I think at this point, we had a really good generative discussion, but it's not going to lead to any action on the part of the committee to sort of change who has access to the data system. And those are our 2 main items. So that's my report.
Thanks,
Thank you.
Sharon. Okay. Katie, has your group met by chance?
No, I have an email out to Dakota to try and meet as a pre-meeting. And I have I've sent a few emails out and to folks who expressed interest in joining the committee. So there's a chance we'll be taking on another committee member or 2. So upon connecting with Dakota, we'll get regular meetings scheduled and then might even have a slightly bigger group with us at that point. So I hope that will all happen by the time we meet again.
Good. Could we put a list up or a link up to the various different committees so that the new members are also aware, or already, public member can attend committee work as well, I'm sure. Can we just make sure that people know what the various committees are? Yep, there you go. You guys are
And I
good.
can report out on coordinated entry. I apologize for needing to go last.
Okay.
I am en route to pick up children. The coordinated entry committee meets on the first Friday of each month at 11:30 to 1 p.m. I know that a couple of folks have expressed interest in joining, and I apologize, I'm getting caught up on my email right now. We were able to move forward with the vulnerability policy that we had requested the advisory council approve in order to help streamline our coordinated entry process. That went into effect on September 1st. Perhaps an ACEH staff member can let us know whether or not that is currently on the website. I know that it is intended to be displayed so that any provider can have access to that tool and see how we're using it to streamline coordinated entry. And we continue to work on that policy. So we're going to be fine tuning it over the next couple of months, as well as talking about whether or not we need to coordinate with some of the other committees to talk about diversion versus housing within the continuum. I don't have more information on that yet, but I can tell you that some representatives from DOC will be joining our meeting at the beginning of next month to talk a little bit about reentry and some of the challenges that folks are finding within that community. And I think that that's all I've got. Thanks.
Thanks, Julia. Does anybody have any just general updates outside of committee work that they would like to bring forward?
This is Jessica. I will expand on what Julia shared in terms of the coordinated entry changes from a staffing standpoint. So ICA, as soon as that was approved, ICA went to work building that into the CE prioritization list. And on, I think it was Thursday, was the first day that the prioritization list was produced with that new information taking into account. So as you can imagine, it did change how the prioritization was. So the person who had been number one on the prioritization list that changed. So now that we have that new prioritization list, as providers request referrals, we'll be using that. And all of that information will be updated on the website now. We didn't want to update it until we were using a prioritization list that actually had that new ranking in place because it took some time to get that set up on the back end. But starting this week, if we have any referrals to make, it will be using that new process and we'll have that on the website. But for right now, people can find it on the website in the meeting materials from last month.
Okay, thanks, Jess. Okay, so why don't we go into, I guess you, Jess, and the ACEH report, government and operational updates.
Right back in. All right, so government updates. There hasn't been a whole lot happening at the federal and state level. On the federal level, one thing I will share, I'm sure that people are watching this, but we are inching closer and closer to the end of the fiscal year without a budget compromise or a continuing resolution in place. So if it does reach September 30th and the end of that day, and that still does not exist, the federal government will go into a shutdown. You might remember the last time I think this happened, I think it was 2018, for any significant period of time. I have had a conversation with AHFC. So if you have landlords or if you yourself are a landlord wondering how that might work, hopefully I'll have some information back from them. But the previous time that there was a federal government shutdown, ACA or AHFC was able to commit to be able to help cover any rent assistance payments that were in the hopper to be paid. The October rents are all paid out of September funds, so it would be a full month before any of that would go into effect or people would see that. But I will make sure I share that information as AHFC has anything available. Otherwise, I would just remind everyone that if the government is shut down, then that means that ELOCS is also shut down. So if you are a CoC grantee or any other HUD or government funding, if the government is shut down, you probably will not be able to access any drawdowns. So if it's not your current practice at your agency to draw down funds at the end of every month, you might think about doing it prior to the end of September 30th. Moving to local updates, that there has been some news and some traction. At the Assembly Committee on Housing and Homelessness, the emergency cold weather shelter plan for the single adults was fleshed out a little further by the administration. At the last assembly meeting, there was a resolution brought forward asking the administration to explore the potential of using the Solid Waste Services Administration building as either a small congregate shelter or a navigation center, or some combination of the two for this winter emergency cold weather shelter season. So at the committee meeting last week, Alexis with the administration shared that they had done some research into the use of that facility as a congregate shelter. There were still some things they were working through in terms of code. There were assembly members who had questions about the zoning, and that area and that building is in a parcel zoned industrial. So there was some concern about the safety of the surrounding area, since industrial typically is not allowed to be used as a shelter or any type of residential area. Looking forward to hearing more about that. And there's a work session scheduled on Friday to go through that. Otherwise, there's an ITB open right now that is looking for providers and non-congregate units to move forward with the use of a non-congregate model for the majority of the emergency cold weather shelter for this winter. That ITB closes on Friday, and the assembly meeting, so not tomorrow's assembly meeting, the next one, so 2 weeks from then, is when those contracts would come forward to the assembly for approval. And the health department is hoping to have emergency cold weather shelter for single adults turned on somewhere between October 15th and October 31st.
Do you know if they, I heard the conversations about hotels. Would that be done at the subsequent assembly meeting? I mean, it's not disclosed how many beds or how many spaces at this point?
Yeah, that's what the ITB is out for.
Okay.
So there was an original preliminary RFI, request for information, that went out, and there were, I think, 4, if I'm remembering what Alexis said correctly, 4 providers that came forward as in response to that RFI with available hotel rooms to use. So now the formal ITB is out, the intent to bid, and then they'll know for sure who was just saying, this is something I might be interested in, versus I'm for real wanting to do this, let's negotiate a contract. And then that will come, those contracts will come forward for the assembly. So it will be for the hotel rooms and the provider to provide those operations and supportive services for the non-congregate beds.
Got it.
All right, operational updates really quickly. The mission moment, I shared the exciting connections at the Built for Zero conference. For general CoC and HPRS, I would just share that the coordination of outreach services continues. The monthly mini project Homeless Connects. The next one is on Wednesday. It will be in the area in between Lusac Library and Cuddy Park. So that little lawn space where if you have kiddos, they hold the book walk all the time. So in that space is where we'll be with the outreach teams this Wednesday. And then October, we will be holding, I'm not going to call it a mini Project Homeless Connect. We'll be holding a full-fledged, full-scale Project Homeless Connect back down at the Egan Center as it had been pre-pandemic. So if your organization or you yourself are interested in volunteering out there or attending as a service provider with a booth or table or wanting to share any information or resources, please reach out to me and let me know. Otherwise, I hope we see people around and help everyone get transitioned into winter shelter. And I see Roger's hand up for me.
Sure. I was just curious about last week's news and the fire at the Golden Lion, if we have any updates on impact.
The fire at the Golden Lion, I don't have any updates other than what I think we all read in that news article. I know there were a few units that were taken offline right away because of smoke and water damage. But my understanding was that it wasn't catastrophic damage to those units and that they were able to accommodate the tenants of those units in separate spaces in the facility, and that they weren't, there wasn't discussion about large scale displacements from it.
Gotcha.
If I hear any more information, I'll let you know. I will share that there was, you may have seen in the news last night, there was a fire in the encampment back behind Ben Boki, kind of between Ben Boki and the football stadium, in the wooded space back there. And that did result no injuries, no deaths, but there were 4 or 5 residents that lost their tents and their belongings. So that was very recent, just happened yesterday afternoon. And we should hear some more information today from the outreach teams and the CAP team if there was any response needed out there.
Thank you.
Yeah, and let us know just if you hear if people need clothes or anything like that. I mean, I know that we have clothing closets, and I'm thinking, others might as well. So if there's some things that we can do, just let us know.
Yep, I will.
Okay. Well, thank you.
Oh, it's me again. This is
Yeah,
just
I was
going to
gonna
be the Jessica
say,
show.
I think it's you.
Jessica,
Right, so
you
yep.
need to be able to share your screen.
That's what I was just going to say. Do I have a screen share?
Let's see here.
It looks like it's going to let me.
If it doesn't, okay, good, perfect.
That work? All right. Okay. Oh, now I have to get it back so I can see you all. Okay. So this is what I'm going to do is run through the draft of the collaborative application. This is also posted up on the website. So we have an opportunity. The collaborative application is due on Thursday. So we have an opportunity for it to be posted for 3 days prior to that submission, where we're able to take feedback, make changes, or any edits that people might see. So I'm going to walk through this. It is a fairly lengthy document. I want to say 95 pages, I just saw at the top here. So I'm not going to be able to go into detail on every single question in every single section. But if you had an opportunity to participate in any of the community convenings that were held by the contractor Agnew Beck, that's who we contracted with to help pull some of this information together. You may have also had an opportunity to have a one-on-one session with Katie or Curtis at Agnew Beck. So they gathered some information to help strengthen some of the areas where we didn't maximize points in previous years, so that we could focus on making that improvement this year. All right. So at the top here, I'm just going to share, this was our scoring summary from last year. So if you look here, you'll see that last year, the maximum score was 200 points. Our CoC scored 151 points. And then you can see some sections here where we had room for improvement. So we got full maximum points on coordination and engagement. So having an inclusive structure and participation. We were 7 points short of full scores, or full points on coordination with federal, state, local, private, and other organizations, however. So that was a focus area for us this year, along with the, I guess those are all together, it was just split in half there. We came really close to full points on project capacity review and ranking. So that's our local competition. So while we did make some improvements this year, it wasn't a focus area for improvement for us. The same with the point in time count. We only missed out on 1 point there. So while we did revisit those sections and strengthen them, we focused on those coordination and engagement questions. And then these two down here at the bottom, system performance and coordination with housing and healthcare. So system performance is a hard one because we don't get a whole lot of control over it. System performance is how well the grants that are funded by CoC sources and the community as a whole that are participating in HMIS, what those outcomes were. But we did strengthen narrative sections in those areas where we were able to. And then coordination with housing and healthcare. Thankfully, since we finished up year 1 of the housing and healthcare integration pilot, we had a lot of really good data and really good information and some really good partnerships that have come out of that, both with the with ACH as the CoC lead and all of you. So we were able to really build on our application last year in that area. Last, I just want to highlight for everyone. So out of that 200, nobody nationwide, no CoC scored 200. So you can see that the highest score for any CoC nationwide was 188.75. And the lowest score for any CoC was 53.5, which gives them a median score of 154.5. We scored 151 last year. So we weren't very far off the median. So I think that that is an important thing to go into this, knowing that while we did have room for improvement in some sections, we started off in a pretty good area. All right. At the beginning here, there's a table of contents that walks you through. So if you're looking for one particular section, you can jump straight to it. I'm going to skip past all of this beginning part. This is just some instructions. So this is the section that we scored high on last year, and we will likely continue to score very high in this section as well. We have a lot of partnerships between ACH as well as all of your organizations, and we have really good participation in our meetings. So when we hold all CoC meetings, we get a lot of response and we have a lot of people coming to the table, as well as our case conferencing meetings where we will be pulling together our direct service providers as well as those partners that are helping support them. So having a lot of that in-depth involvement has really helped us in these sections here. All right, so I'm going to scroll down a little bit here. When you see the green sections, those are our narrative responses to these questions. So you'll see in these green sections, places where we've highlighted how we do some of these things. So there's always a data portion where it's really a yes or no, or what did the data tell us? But then we get these narrative sections where we get to expand on that and talk about how we do things and why it's still a strong way of doing it. One thing that we did highlight here is we've really ramped up over the past few years the social media reach of ACH. Taking into account being the lead agency for this COC, that's how we share a lot of this information. So we share a lot of the event information out there when things are changing within the HPRS or there's news to share. So we really highlighted where the social media reach has grown over the last few years as a way to highlight how some of that outreach is done. This section here talks kind of that same information, meetings that are held where people are participating in federal, state, and local organizations and providing that feedback. So this section is talking about public notification, where we're looking for organizations that haven't previously been awarded CoC program funding. So as Sid shared, this year we had the highest number ever of new projects or bonus project applications. So that was really exciting. And I think that it highlights that word gets out and that people are hearing about this opportunity. This section is really rote. We have to talk about the actual days where things were shared and then give them screenshots showing like it was posted on the website on this day. We held a webinar on this day. So that's really just kind of pass or fail. Either you did it or you didn't. All right, so this was a section that we were able to build on because last year we did not get full points on it. This is the coordination with federal, state, local, private, and other organizations. Check here. I don't have the chat open at the same time as sharing my screen, so I wanted to make sure that I wasn't missing anything there. And yes, I will get a link to this in the chat. All right, so the guidance for this section talks about us consulting with organizations that award funds at the recipient level, not at the subrecipient level. So this is asking, do we coordinate with the planning or the operations of projects? And so this was a lot of one-on-one conversations with organizations to make sure that these connections that we may not have had in the past, or we may not have documented in the past, that we have them. So reaching out to organizations that serve families, for example, and asking if they are coordinating with organizations that are running Head Start programs, reaching out to people who are non-CoC funded and asking if they're collaborating with the CoC funded projects. So it was exciting to be able to answer yes to all of these with our outreach that was done. This section here, so we highlighted that the municipality of Anchorage as the participating jurisdiction is the recipient of the ESG funds, administering the consolidated plan for our geographic region, which is the Anchorage CoC region. Highlighting that coalition staff participate and attend all meetings of the HAND Commission, which is where that action plan goes through. One of the things HUD is looking for is that recipients of HUD funds are collaborating with other recipients of HUD funds. So by showing that interaction and that collaboration, I hope that strengthens that response to them to show them that not only are people collaborating at the recipient level, but as the coordinator of the funding, the health department and ACH are collaborating and providing feedback. Also, this year, Jed from the health department, who is the participating jurisdiction, like overseer of that funding, Jed was able to sit in on our rank and review process. And so he was able to observe and provide some feedback there as well. And hopefully in the future, we'll be able to collaborate more on how announcements go out and have similar processes for how rank and review might happen. All right, this section here talking about trainings that are happening. So this one, we did have one no answer that I hope that we strengthen next year. That making sure that there is a mandatory training for all CoC and ESG funded service providers on family separation. There's some HUD guidelines on how family separations should be managed. And so making sure that in this upcoming year, at some point, we're prioritizing that there's a mandatory training for all of those grantees. It's not to say that it's not happening, but it's not happening in a coordinated way that we're making it mandatory for those recipients. So conversations with the health department, making sure that we can help facilitate that mandatory training. But otherwise, yes answers to the rest of those. That was really exciting. Collaborations relating to children and youth. This one was another one that was great to check yes on. We have collaborations among our service providers and at the CoC level with youth education providers, and then the state and local education agencies, as well as school districts, which in Anchorage, we just have one, but able to mark yes on that. And then again, the narrative just highlighting where those relationships exist and how they're codified with MOAs, either with service providers or in support of our CoC collaborative application. All right, this section here is focused on the domestic violence, dating violence, sexual assault, and stalking survivors. So a lot of this information came from Awake, because why reinvent the wheel when Awake is doing it so well? So a lot of this information came from Awake in how some of those collaborations happen. And in fact, it looks like our very first sentence was the CoC relies upon the subject matter expertise of Awake to inform and update. Highlighting that we have service providers that have that very specific expertise here. This is an area that scored really well last year, and I think is evidenced by receiving those DV bonus funds last year. I'm going to scroll through that. That is a large section on the DV section. All right. Next section is talking about addressing needs of lesbian, gay, bisexual, transgender, queer plus, anti-discrimination policies and trainings. So this was another one where we have an opportunity this year to do better. We do have written CoC-wide anti-discrimination policy as part of the written standards. But again, we don't have annual CoC-wide trainings on how to effectively implement the equal access final rule. And then the same thing under the gender identity final rule. So this was a conversation we had about how we can strengthen this going forward. And I know that different providers are doing some of this work individually, but we didn't have anything CoC-wide. And I see Julia with their hand up.
Thanks, Jessica. Understanding that we can't do yes answers in this section, I'm wondering whether there's a way to include language, both in the upper section, which I privately messaged to you, and also perhaps in the narrative around DV work that just says serving people of all genders. I know Awake is doing really great work to that extent. And so even if we're not saying yes in all of these sections, in the LGBTQ specific, maybe we can build it out in the narrative of other parts, increasing our chances to score higher.
That is great feedback. And I will, Katie is in here with me too. So I'm sure Katie is also taking copious notes. Like I said, we have these next 3 days to make some of these improvements. So what I'll do is work with Agnew Beck on incorporating some of that language, and then send it out and make sure it's capturing the essence of what we're looking for there. But this is why this is so important, and I'm so excited to get feedback. And this would be the section where we would want to build that out in this narrative piece right here, as well as the section you called out about the culturally specific outreach. So this is where we'll incorporate that in. All right, the next section is a collaboration section with the public housing agencies within our area. As you know, Alaska only has one PHA, and that's AHFC, so it serves our entire area. So this is sections that we don't necessarily have a lot of control over, but we do have these documents from AHFC to upload along there. And I would encourage everybody that every year when AHFC releases their moving home plan, that you take a look at that and look at where there are suggestions for improvements in there, recognizing that it's a statewide plan, but since they are the public housing agency that is over our geographic area as well, everything they put in there will apply to us as well. So one thing that we were successful in doing in the past, in 2019, we helped develop a homeless admission preference and prioritization for homeless populations through voucher set-asides, different types of rent assistance, and then a formal MOU for the EHVs. So it was great to be able to highlight the areas where we are collaborating well and we are providing input into that plan. This was again something that was really exciting to mark yes on. Last year we had the section was a little bit different, so we weren't answering yes on every single one last year, but the way the questions are worded this year, we're able to answer yes, that we do work on essentially work with these organizations and with people who are using these types of funding to develop affordable housing providers in our CoC to participate in our projects. So this is, do we have these types of units from public housing programs participating in coordinated entry? This is a space for us to improve in the future. By partnering with AHFC on administration of EHVs, we were able to have the EHVs working with the coordinated entry process, but the other voucher systems that exist through our public housing agency don't currently use coordinated entry. So this is an opportunity to improve and have those conversations with AHFC if there's a possibility for a set aside or for those prioritizations and participation to happen. Yes, Allison.
So I'm not seeing the exact title of the ones, but our rites of passage has vouchers and we use the coordinated entry. So, and I'm sure Jason and Aurora were a part of this, but we can get the information to you if you need to, because we do use the coordinated entry system.
Do the rites of passage, do those vouchers go through AHFC or do you guys administer them? They're through AHFC? All right.
Yeah.
I will find out what type of voucher they are and we will answer yes to that one.
Yeah.
This section here is also a place where this is an all or nothing for these points. And this is looking for if the CoC collaborates with the housing entity to submit a competitive joint application. So there's a bunch of different programs that HUD puts out and funding opportunities that the applications are joint applications between the Housing Authority and the CoC. And so we didn't apply for any of those this last year, but this is now highlighted as something to try to do in the future. Yeah, so hopefully that's something that we can answer yes to in the future. It was exciting to answer yes, that there was a coordination for the EHVs this year, and that we do have an active MOU to do that. So we'll get full points on that section. This is a section that we do really well, discharge planning coordination. So foster care, healthcare, and mental health care. It's hard with the lack of units that we have right now to make some of those collaborations work, but they're happening and those conversations are happening. So that's great. Did spend the narrative section here highlighting how some of those collaborations happen and how we're ensuring that housing first principles are being followed and being implemented at the different programs. Over the upcoming year, we'll be putting in place we'll be putting in place a process where we're able to monitor that with our grantees throughout the year. So it makes it a lot easier to answer some of these questions at the end of the year. All right, this section we got 0 points on last year, so we really focused a lot of time and attention on this section. It's around street outreach. We highlighted in here the coordination of the outreach program that was started last year, where the organizations that are providing outreach services are all coordinating with each other in the ways that they determine where they're going out to do the outreach, how the outreach is happening, as well as the funding and the ability to provide the basic needs services. Highlighting the work that was done this summer around the Project Homeless Connect events, as well as the pop-ups. So providing outreach in a way that takes outreach to the people instead of depending on people to come to us. So this section was great. Everybody who is an outreach provider or has been participating in outreach services was consulted. Their information was brought in here as well. So I hope that we score more than 0 that we had last year. This section, strategies to prevent criminalization of homelessness. We scored full points on this section last year. So I feel pretty strong that will be a place that we continue to score well coming up. I see it as 4:56. I'm going to go a little bit faster. You guys are able to look at this too. This section talks about I'm going to skip actually to the next place where we had lower points. I can talk about this application all day, as you can tell.
I think just in fairness, I mean, do we need to ask if we can stay like 10-15 minutes after, because I mean, this is really kind of our role. So
yeah, if people are available to stay a little bit later, I'm available to stay a little bit later and go through this. There's one more section where we didn't score the full points that I wanted to make sure I highlighted, and that was that healthcare integration section.
So I'm available. Are members available? Participants? Okay.
Yeah, I am. Do we need to then vote on approving this?
Yeah, so your vote, yes. So your vote is really kind of an acceptance vote, not necessarily an approval vote, because we recognize that the document is still in draft form because we're now accepting that feedback. But yes.
Okay. So Sharon or Sid, as far as Robert's rules, do we need to do anything other than, I mean, I know we've established quorum already, so we should be able to move forward if people leave.
Yeah, we should be able to move forward since we established quorum.
Okay, good.
Yep, I was going to say that.
So we'll give you 15 minutes, Jess.
All right, I will finish in 15 minutes.
There you go.
This section here, just letting you know, before Thursday, once we have all of this feedback incorporated, what I'll be doing is circulating to the executive committee a letter for you to basically sign off as representatives of the advisory council, that it's demonstrating support of the application. But I don't want you guys to sign that today, because I want you to sign the final I want you to sign a letter supporting the final version of this. And as I said, this is posted on our website. So we will continuously update the posting on the website as we incorporate this feedback.
Hey, Jessica, can you point where it is in the website? I kind of looked.
Oh, yes.
I couldn't see it.
Let me get a direct link. I messaged Sasha and Taria for a link, and I'll pop it in the chat. All right, so this section here at the end here talks about participation by people with lived experience. That is a place that we are strong in our CoC with. We can always be better. We have talked as a advisory council about a lived experience advisory committee. So I think that is a way that we could really strengthen. I think a way that we could really strengthen this section as well. Definitely not saying that we didn't score well in this section. We did. And I don't know if that's a testament to how amazing the work that we do is, or who we're being judged against, because I always look at how we could better involve and better amplify and raise up the voices of people with lived experience when we're developing these projects. So I think if we do move forward with developing that committee, that would be something to highlight this upcoming year and in next year's collaborative application. So talking about routinely gathering feedback, addressing challenges of individuals with lived experience of homelessness. And I think that's a way, a really formal way to gather that feedback. But one thing that we did highlight is that almost every single one of your organizations and the grantees that are funded through CoC funding have a process themselves to gather this feedback and address those challenges. So really, I think where we would be stronger as a CoC is bringing all of that information together and either doing some ways of gathering that information or some ways of getting that feedback as a whole CoC, or better collaborating with each other on how we bring that information together and to each other. Increasing the affordable housing supply. This is another section where we got 100% of the score last year, which is funny because we hardly increased the supply 2 years ago at all. But I think it shows that we're trying, and that as a CoC and as our providers, we have great spaces in advocacy, and we really work with our local government, with our state government on ways that we can encourage affordable housing development. All right. This section is just all of the pieces of uploading all of our documents. All right. So this section, addressing severe barriers in the local project review and ranking process. This is that section that we only missed out on 1 point. But I'll still highlight it here for you because we did not get 100%. So this is places where we are able to adapt how our rank and review process looks at barriers that exist within our CoC. So recognizing that there are certain project types or there are certain subpopulations that may not score very high when it comes to looking at successful outcomes. Like if you are a program that is serving a population that has some pretty high service needs, or low or no income, which we know is a portion of the people that we're providing services to that sometimes have no income. So really highlighting that when you are providing services under a housing first methodology, it can sometimes mean that certain projects just don't have as high scoring outcomes as less restrictive projects. So this just is looking for places where we talk about how we are analyzing that data. Highlighting that we are requiring use of HMIS, not just for local HUD funded projects, but that philanthropic funders like Rasmussen and then local government like the municipality of Anchorage are also requiring that use of HMIS. And so that helps us to ensure that the data that we're gathering and the outcomes that we're measuring are meaningful across the COC and not just within our small pot of COC funded projects. A lot of this is work that the data committee and the HMIS advisory board look at on a regular basis, making sure that that system analysis and that data that we're gathering is actually telling the story of our COC. And when it's not telling the story of our COC, that we're taking action to make sure that we are looking at that and how we can improve, how we gather that information and how we report on those metrics. All right, and then this last narrative section is talking about how project applicants are asked to provide that information on the services that are being provided so that we can make sure that when we are doing that evaluation and looking at use of coordinated entry, looking at housing first implementation throughout those timeframes, that we're taking that into account. And so then when we look at the scoring criteria, we're not just basing it on those outcomes, we're basing it on narrative sections as well. And anyone who participated in rank and review either this year or in prior years will know that those narrative sections are weighted in that project. We don't just look at the outcomes. And then this is a section where the conversation that we just had, the information that Julia shared, I'm sure that we will be coming in and making edits to this section, but this is our narrative section where we're able to talk about how we're ensuring that populations that are underserved and overrepresented in experiencing homelessness are taken into account when we're doing ranking and scoring here. And then making sure that we're reaching out when we're identifying a need for strengthening those conversations or strengthening the collaboration between those organizations, that we're doing that. Making sure that our rank and review committees are including representatives from those subpopulations or organizations that are helping serve some of those overrepresented, underserved populations, and that comes into play during that process. Reallocation, reviewing performance of existing projects. So making sure that there is a reallocation process in place. Sid talked about this at the start of the meeting. So making sure that there's a process for how your rank and review committee looks at those applications and identifies projects that are candidates for reallocation. And then when there are projects that meet that criteria, that reallocation is happening. this section. So on our website that I'm sure you all have seen, this section is just the uploading of the emails that went out, uploading of that matrix of the projects that were selected, and where the tier 1 and the tier 2 cutoffs are. Some of this is some e-snaps sections here. This highlights what our chart needs to look like. You guys are getting some of the sausage making side of things here. All right, this section talks about HMIS. There are some data reporting that happen through ICA related to our point in time count and our housing inventory counts. So housing inventory count data, as I believe all of you know, is collected quarterly. However, when we do our point in time count, we upload that quarter's HIC data as well. So this is asking basically, did we submit it by the deadline? The deadline was 4/30, we submitted it 4/26. This section talks about comparable databases for DV providers. So this is just ensuring that if we have DV providers, that they are using a HUD compliant comparable database, which Awake does. This one is strictly data. So this is a report that comes out of HMIS that is really just talking about our bed coverage. If you have bed coverage rates that aren't being filled completely. So bed coverage rates at or below 84.99%, you get partial credit for that. So that information gets uploaded. We did have one project type with a bed coverage rate below 84.99. It was rapid rehousing. And so that has been a historical place where we've had challenges. The highest, like really, the reason for that is the lack of units. It's everyone who administers a rapid rehousing program knows that it's really challenging to fully utilize a rapid rehousing program when you can't find a unit to put that person into. So really this just talks about ways that we will continue to work and continue to try to encourage development of affordable housing, encourage participation by private landlords in accepting that type of assistance. And I think until we see more units, it's going to be really difficult to change that number for, you know, the foreseeable future. But I feel good that showing that we have good bed coverage ratios on all of the other sections aren't hurting us substantially. Again, some information about our data and was it submitted on time. This section, we got full points on it, but I'll highlight it here. Talks about the point in time count and how we are effectively counting youth in our COC's most recent unsheltered PIT count. Get to highlight Covenant House here because the Covenant House outreach team does an amazing job when we are doing our point in time count, helping us to identify places where we might find unsheltered youth, working on making sure that we get good counts in our emergency shelters through Covenant House, and those outreach team members do a great job of assisting through that process. This is asking if we've made any changes to how we did our count between 22 and 23. This one made me laugh a little bit because we all know what the point in time count 2022 looked like. So anyone who said they didn't have any changes is probably a liar at that. So that one did make me laugh, but we did talk about how in 2022 the point in time count was really challenging, and the changes that we put in place made our 2023 count really accurate. Talking about strategic home, identifying risk factors to identify people who are experiencing homelessness for the first time, and then also at risk of becoming homeless. So this is looking at that prevention side of homelessness and the HPRS, so homelessness prevention. And this is talking about in anchored home, that gap analysis and that research and needs assessment help us identify places to look to identify people that are the most at risk of becoming homeless. Also, the coordinated entry system, diversion and prevention, that partnership with United Way, the court system, Alaska Legal Services, has really helped us to help identify when a family or individual is at risk of losing their housing. We did not have any natural disasters that impacted our first-time homeless. Highlighting the upcoming changes to coordinated entry in the coordinated entry section. This is a section that has been really strong for us in the past. Strategies to reduce the returns to homelessness. Most of this information was gathered through interviews with you all, with providers who are providing permanent supportive housing or rapid rehousing programs. The same with these sections, increasing employment cash income. So these are all things where the data is the data. So if we have programs that are, if overall as a COC, we are not seeing substantial increases in employment cash income, this is our ability to highlight what we're doing, what our providers are doing that are addressing that. And I think that might have been it. Because we didn't have any new DV bonus projects. Yep, that is it. So yes, so typically the natural disasters have to happen locally. But that is a really good point, that sometimes those natural disasters happen outside of our COC, but impact our system. Yeah, that is something to think about. And definitely, I'm glad that the person asking that is the person who is the chair of the CE committee, because that's something we could build into that CE assessment. Asking people or having a conversation about what led to their most recent experience of homelessness. And if some of that information reveals that it is a non-local natural disaster that led to that, that is information that we can use to help build out that system of response. All right, so go ahead and launch that poll. I will share that if you have questions and want to provide feedback, you can absolutely email myself or Taria directly. You can email our grants@ach.org email address, which is a distributed email that goes to a couple of us. And we will take all of that feedback in, share it with AgNewBek, and get it out to the website.
Jessica, I have to say that was one of the best presentations to go through. It was great to have your knowledge of previous plus, right? So thank you. Great job.
Thank you. And I will share, I took so many notes going through this process and being on this side of it, that I have so many ideas of things to do over the next 9 months, so that next year's application is super strong.
That sounds great. And it looks like we got 100%
all right
of it. So, okay, now you can drink your water and rest your voice, Jess.
Thank you.
So just don't want to miss an opportunity to give people a minute to announce any good news or community events that are coming up. And I will say, I have one good news, which is that Covenant House was awarded a federal prevention grant. So that's the first time. So there were 200 communities that applied. There were 10 communities accepted, and Anchorage was one of them. And so I look forward to being one of the first to do prevention work in our HMIS, right? So it's a good thing, and it's from another federal funding source. So there you go, another bonus point. Okay, do we have any other good news or upcoming events? It's not too late. I think we have 3 days. Well, so I would just reach out to Jess, and if you see some areas that you would like to add, that would be great.
I think Will's saying we should include that you received the prevention
Oh, there you
funds
go.
in that application.
I'll
Oh,
see
there
where
you
I
go.
can fit it in. I will share that the application is for like when we're presenting our data and talking about it, it's intended to be the period ending June 30th, 2023. So they try to cut it off. The NOFA was launched early July, so they try to say like anything you did after the NOFA was launched, it kind of looks like we're doing this just to get the points. But there are sections where we can talk about upcoming plans. So I'll see where I can fit that in. You're right. That's a really good.
We have to. I mean,
point.
we submitted it in June, so
Yeah, exactly. So
There
if
you
we
go.
can say things like pursuing this.
yeah, there you go. Thanks, Will, for bringing that up. Listed are the upcoming advocacy opportunities, assembly meeting on the. Wow, are we past these dates? I think we are. August 8th. There you go.
That's not the correct one. I apologize. I'm not sure why that was on there. Give me a second and I can share
Okay.
the one.
I'm also going to hop off. Yep. Thanks, everybody. I got to run. Bye.
Yep. So here are, well.
Nope, that's wrong too. I'm so sorry. I'm not sure. I must have inadvertently done that. I can email it to everybody though.
Yeah, if you would do that, that would be great. I want to appreciate everyone staying an extra 15 plus, and we're well on our way to submitting a strong COC application. Thanks for everybody's hard work on it.
Thanks.
Okay.
Have a
Thanks,
great-
everyone.
Okay, have a great night.
Bye.